I would love to go to South Korea. Like, I've been wanting to go to South Korea because
You're really
I have.
excited.
And you've been there many times for cosmetic procedures, right?
I mean, this face needs a lot of work.
Oh, we were going to surprise you.
Yeah, we're making it up as we go along.
Hello, welcome to Meanwhile in Asia. I'm Kunal Sehgal.
And I'm Ivan Watson. And Kunal, I have a question for you. Do you like going to the doctor?
I don't, but I don't think anyone likes going to the doctors.
No? Would you consider flying to another country to go see a doctor?
Well, so I do actually. I mean, even though I have health insurance here, I do tend to fly to India to seeing my dentist or even for diagnostics stuff. It's just more convenient and definitely much more cheaper. But I mean, for a lot of Americans, I don't think that's common. I mean, imagine flying halfway around the world, not for vacation or for business, but to go see a doctor. And a growing number of Americans are doing that, coming to Asia.
Not just coming to Asia, but part of what we're going to talk about today is Americans and other people from around the world traveling specifically to mainland China for medical treatment, part of a growing, relatively new industry there.
Yeah.
So to discuss this kind of medical tourism, we're going to turn to our resident expert on medical tourism, Stephanie Yang. Great to see you.
Yeah, thank you.
Welcome to the show, Stephanie. Now, I read your excellent article about medical tourism in Asia. So you've talked about how China is becoming a major player now. It's emerging as a major player. South Korea, of course, is an established industry. And then Macau starting kind of like a nascent niche industry, medical tourism industry. But let's start with China because
How big is it? I mean, are they really players? Are they a destination?
Yeah, in the past couple of years, it's grown a lot. So according to Chinese state media, they saw a record number of foreign patients last year as 1.28 million. So the growth is there. And then anecdotally, I've been hearing more and more about people who are willing to go to China to get everything from, you can do dental care, you can do cancer treatment, you can do liposuction, you can do any kind of surgery, really. It's available in China.
And you had a case study in your article about an American man who traveled halfway around the world to go to China for some kind of treatment, right?
Yeah, I talked to this 26-year-old from Atlanta, Georgia, who had to have a surgery done. It wasn't life-threatening, but it was something that he had to do in the next year, his doctor said. But it was going to cost $10,000, $11,000 at home. It wasn't covered by insurance. So he and his dad started looking for other options for them to try and cut down the cost. And one of the ones that they found was in Shenzhen. And he got quoted, instead of $10,000, he paid $2,000 for the same surgery. And then he spent his next 2, 3, 4 weeks just traveling around China because he'd gone there on a tourist visa, had the surgery, had the entire recovery process, and then just went sightseeing.
How are companies marketing to Americans to come and get treatment in China?
So if you Google medical tourism in China, you actually get several, I think, SEO optimized results that will come to you and say, do you want to explore medical surgery in China? We can help you. And so with this 26-year-old that I interviewed, he worked with a medical tourism agency that just launched last year and was essentially targeting Americans who want to go to China and get procedures done.
I guess for a lot of people, it's probably not the first place that comes to your mind when you think about medical treatment. And I mean, just 5 or 6 years ago when the Chinese introduced the COVID vaccine, I mean, not a lot of people...
That's right. There was a lot of suspicion about it. And
Yeah.
here in Hong Kong, there has been suspicion about kind of quality control in China. I'm old enough to remember that baby formula, there were scandals about kind of tainted baby formula being produced in China and resulting in kind of quotas and limiting export of baby formula here in Hong Kong to mainland China. That's just an example of the distrust and some of the suspicion that was there. So it's a pretty dramatic decision for a guy in Atlanta to go, it's better for me to go all the way to China than to do this at home in the U.S.
Yeah, and that's one of the things that really struck me when I was looking into medical tourism in Asia, when I heard that people were going to China, which is what a lot of these medical tourism agencies and consultancies were telling me, it didn't make a lot of sense to me, because I think for a long time, China has had this reputation of low cost, low quality goods. But only in the past 5 to 10 years, they've really started to turn that narrative around. If you look at some of the homegrown Chinese champions, if you look at BYD outperforming a lot of electric vehicles. If you look at Huawei, they have, they're very, very competitive in phones and electronics.
But it's really different to have people start digging around in your body.
Yes.
Well, but it seems like they've made a lot of advances in healthcare, China, in the last decade, especially in cancer treatment.
Yes.
I saw one of the ads that you'd shared, and it said, hey, there's a 3-day tour. We're going to give you VIP access when you land at the airport and take you to a 4-star hotel. You get a day's checkup the next day. And then for day 3, we get to take you to the panda preserve, and you get to go see the pandas in Chengdu.
Sold.
But I do think this then sheds a light on how desperate some Americans are, and people in other countries as well, what would drive them to fly halfway around the world.
I mean, you guys
care.
tell me, you guys are Americans. I've heard a lot about how the healthcare system in America is not very inclusive, but do you guys have any horror stories?
I think the horror story is the sheer cost of healthcare in the U.S., which is really massive. So the medical bills in the U.S. are astronomical. Add to that the fact that you have tens of millions of Americans who have no health insurance whatsoever, right? And then other Americans who have health insurance, but then coverage can be spotty and there can be procedures that are not paid for. So that is part of what is driving Americans out of the country for medical tourism. They go by the millions, according to the CDC, normally to Canada and Mexico. This is a relatively new trend, I think, going to China.
And I think also just, growing up in the US and having to worry about my health there, I just had this aversion to going to the doctor or the hospital whenever I could avoid it, because there was all of this uncertainty around how much would this ultimately cost, even with insurance.
Did you ever any personal horror stories?
So the one thing that stands out to me is that one time when I was in college, I went to the urgent care clinic because I'd gotten food poisoning and I was feeling really sick.
Not a hangover.
Not a hangover, food poisoning. And by the next day I was feeling better, but I thought I would go check it out. So they offered to hook me up to an IV drip for about an hour. I did it. I felt better. I was like, oh, great. And they're like, well, would you like any more? And I was like, sure, I'll take another half bag of IV, whatever you got. And then when I left, it wasn't covered by insurance because it was one of those like urgent care facilities. And I remember them charging me like $700. And as a college student, I was
That's
so
a lot
shocked.
for an IV.
And I was like, I could have just had a Gatorade. Like I didn't have to have this IV bag. But they didn't tell me how much it was going to cost. They didn't explain to me. I didn't understand health insurance or how it worked. And so I can also understand I can understand the appeal of finding an agency that they lay out all the costs for you. They tell you exactly what's going to happen. And there is that kind of layer of accountability, or at least hand-holding that you can get that you actually sometimes wouldn't get in the US.
It's a very lucrative industry, right? And I know they're becoming an emerging player in it right now.
Yeah, what's interesting about China's pursuit of the medical tourism industry is that it aligns with a lot of its national goals. So for one, it's running more clinical trials. It wants to be a leader in biotechnology. It wants to have the most cutting edge technology. And then on the other hand, it also wants to attract more foreigners in to visit and to spend money. Because you're right, the domestic economy is slowing. Chinese consumers, they don't really want to spend. And so in the past couple of years, you've also seen China loosen visa restrictions for travelers from the UK or from Australia, and that's also helping draw more people in because it's easier to just go. You don't have to get a medical visa or even a tourist visa anymore.
So the Medical Tourist Association is this nonprofit that promotes medical tourism, and it estimates that the global industry for this is worth $100 billion. That's back in 2024, and is growing by 15 to 25% annually. I think it's really important as we're discussing this to point out we are in no way endorsing medical tourism, jumping on planes, going to other countries to do. We're not saying this is the right thing to do. I went on to the Center for Disease Control's website, and they have advice for medical tourism, and they say that some of the risks are flying after procedures. You could raise the risk of blood clots. Continuity of care is a big one. Getting the medical records from whatever treatment you got in, say, Thailand or mainland China or Korea, and then you show up back in your home state or something, and your doctor's like, well, I don't know what you got, and how am I going to work? How am I even going to begin to know this? Communication channels, and then risk of infectious diseases. Any medical procedure can come with that risk. Finally, the quality of care. The licensing and credentialing in one jurisdiction won't necessarily match that in another.
These are real risks, and I can talk about personally when I go to India and I get these tests done, or when I go see a doctor, I do make sure that, like, even not just the diagnosis, but also the medicines that they're prescribing are also available in Hong Kong. These are things that are like common. So I think you have to be really careful about these things. And it is a real risk. I mean, 100%. And that's why when I hear about, the guy from Atlanta, when they're going through these life-saving treatments, I mean, I can't even imagine like how careful you need to be.
But what startled me when I asked around in our newsroom, does anybody travel outside of Hong Kong for medical treatment? At least a dozen people, and talking about their extended family members and friends, all talk about going to other places. Shenzhen, across the mainland border to mainland China, many for dental care, which they say is half the price of dentistry here in Hong Kong.
I can understand that, yeah.
People who go to Bangkok to get their medical checkups for a fraction of the cost. India, as well. Somebody telling about going for cosmetic surgery in Manila for a tweak, as that person put it. Hair replacement surgery in Shenzhen as well. It's really startling how frequent and common this is in this part of the world. Jumping on a plane, flying 2 hours to somewhere to get all sorts of things done.
Yeah. I know there are a couple of people in our newsroom who go to India, including myself. India is also quite an established medical tourism country. I mean, last year, 500,000 foreign patients came to India, and
for medical care.
For medical care, and India.
Where are they coming from?
So they're coming from the region, but also from countries in Africa, and they've already done those things like easing of visa restrictions. So they're now medical visas for people to come and stay up to 6 months. And I think what helps is also English is quite a common language in India, so people can actually come, and that's not a barrier either. But yeah, I mean, I think it's quite a lucrative industry, but you need to find your niche, like you said. And so in India, it's more like whether it's organ transplants or if it's cardiac surgery. So that's what India specializes in. It's what China's now doing in cancer treatment. So yeah, I mean, it's about finding a niche, just like how Macau, which was a surprise to me, is trying to find a niche as well. And that is a very nascent industry, medical tourism industry. And you recently went there to check that out.
Yes, I did. It was another instance in which it raises kind of a question mark. You say like,
100%.
Oh, Vietnam for your procedure. Oh, the Philippines. Oh, Macau, And so, so we went to the hospital that just opened in October within a luxury resort. And their proposition value was that, hey, you come here for gambling or you come here for a vacation with your family, why not get a checkup? Why not have, a laser treatment done while you're here? And so, again, it comes down to branding. You think of Macau as this known as the Las Vegas of Asia. And they're really trying to bring in other types of, economic inflows. And one of those things is maybe medical tourism. So that's something that is offering a lot of countries and territories now a potential opportunity if they can convince people.
But I think the gold standard is South Korea, right? Some 2 million foreign patients visited last year, and they spent around $8 billion and generated more than $15 billion in domestic economic output. That's a good chunk of change.
Let's listen to CNN's Seoul producer, Gawon Bae, explaining how South Korea became the mecca of cosmetic surgery and elective treatments.
The flawless looks of K-pop idols and poreless skins of actors in K-dramas are noticed around the world, and many hope they could look like that as well by traveling to South Korea for cosmetic treatment. This trend can be seen in the areas densely populated with dermatologists and plastic surgery clinics. You can see a lot of non-Koreans in these areas, some even wearing a bandage on their nose or jawline. But I have to note that the trend has been gradually shifting. While about 35% of foreign medical tourists got plastic surgeries done in South Korea in 2018, that number has dropped to 20% this year, according to Korea Tourism Organization. But more than 55% of the tourists have visited dermatologists, where they can get quick, simple, yet effective treatments, from filler and Botox to injecting collagen to boost their skin conditions. It seems like the trend now might be to try to enhance your own features instead of changing them.
Stephanie, I'm curious to know, how did South Korea actually market itself as this medical tourism destination?
Yeah, so I think that South Korea has been growing in its presence of, as we talk about K-beauty and cosmetic surgery for a long time, to the point where everyone, when you think about doing cosmetic surgery overseas, you think of Korea. And it shows that it's really become a branding issue for a lot of these other countries that are now trying to compete. So I talked to, some of these hospitals, some of these medical institutions, and they're all trying to figure out, well, what is my angle here? Like, what is the thing that I want to be good at? Or what do I want tourists or foreign patients to think of when they think of coming to the Philippines or thinking about coming to China? And so you're starting to see some of them carve out niches. Mm-hmm. So saying, like oncology or MRIs, regular checkups. In China, there's been a cancer treatment that's become very, very popular recently because it's been offered at a fraction of the cost of where you can get it other places. So everyone's trying to find their specialty, really.
I was talking to a friend who got a cosmetic surgery done in South Korea, and she was saying that one of the reasons she went there instead of Thailand or some other countries also because is quite accepted. Like if after the surgery, when she's there, like she's not feeling weird about it because a lot of people have gotten that done.
Bandages. And
yeah, exactly. So it's a lot more comfortable for her to just roam around the streets of Seoul and like no one's looking at her like, weirdly, and she can just.
I have friends who make girls' trips out of going to Seoul for some of these treatments.
Really?
They
what are they getting?
They'll pick a weekend. Oh, what are they not getting? They're getting. I don't even remember some of the names of these treatments, but it's anything and everything imaginable. So I think that also speaks to the accessibility and acceptability of going to Korea. If you just tell your friends, "Oh, I'm going to Korea. I'm going to get some stuff done," they're like.
And
cool, tell me where you go.
Nobody questions the health standards there, I guess.
Not really.
So basically, if I want to go and get my face smoothed out and get rid of all these wrinkles and bags and sunspots, I can go fly off to South Korea and I've got just a plethora of doctors and choices.
Yeah, it's actually, I've even thought about going, but it's actually really overwhelming, the list of things that you can do that I can't even really understand most of them. You have, snail mucus. You have salmon sperm is a new thing that people are talking about.
What do you do with snail mucus?
You put it on your face, I guess. I'm not totally. I don't think you inject it.
Salmon sperm?
There are things you inject. There are things you put on.
Salmon sperm you inject. Yeah, they're little micro injections.
Yes. Okay.
So
that's
with the micro needles.
Yes.
Yeah, I mean, I would love to go to South Korea. I kind of want to go to a clinic and tell them, what should I do? But I think that's a dangerous path to go down. But the reason that I haven't done it yet is because I'm worried about the risk. Like, I don't speak Korean. I don't know exactly which clinic. They all look the same to me. And so I'm trying to figure out, I'm waiting for friends to give me recommendations. I'm waiting for a friend who speaks Korean to take me with them. I really need that channel in which I feel safe to go because, even though it is, a cosmetic surgery, maybe it's not cutting me open, it's still scary in a way, especially if something goes wrong and then you don't really have recourse.
And one of the reasons that people do travel is there can be a procedure or a treatment that's offered in another country that isn't allowed in your home country, right? That hasn't been approved by your equivalent of the FDA or what have you, so people can go to another place. That can be for very serious treatments. For something like cancer, you're getting an experimental treatment, or for whatever secretion from whatever animal is the flavor of the month. to stick into your face. Let's be honest, there's an element of that in this discussion here, right? Snail mucus and salmon sperm. Name your additional combination. We have to add a little bit dose of skepticism.
Would you get salmon sperm?
I don't feel... there's a lot you could do to my messed up face, but I don't feel a need to inject salmon sperm protein. I'm not hungry
yet.
for it.
Yeah.
Not yet.
Well, Stephanie, thank you for introducing us to things we have not even crossed our palates. So thank you very, very much.
Thank you so much for joining us for this week's episode of Meanwhile in Asia. We will see you next week.
See you next week.